Hey guys, it's Bo from FOODTALES. Today I'll be going over my recovery process and before and after pics with my lovely sister Trinity. Yay! So before we get started, this is video 2 of 3 of the series. If you haven't seen the first video yet, be sure to check it out. The link is in the description below. I went to Korea for my cosmetic procedure through Dr Korea, and I had my surgery at the famous clinic ID Hospital with Dr Tae Sung Lee. They were very professional and made me feel very safe throughout the whole procedure and recovery process. The first 7 days of recovery is in this video and it will be more in depth. Then we'll switch to a photo montage. Are you ready, sister?
I'm excited to see the process. Yay!
So before we get started, I just wanted to ask Trinity a quick question. So this is day 17 when I left Seoul through passport security, and I just wanted to ask Trinity, if you were a passport officer, would you let this person through?
Well, honestly, the passport photo that you have really doesn't look like you in real life, so, but like your nose, eyes, and mouth are the same. It's just like the thing that has changed is your face shape and your bloated as. So, like, the officer may have just thought that you gained a lot of weight. And also, like, what did they even say when you gave them your passport? Did they not say anything?
No, there was one officer that was like, take off your headphones, take off your glasses. And she just stared at me. She was like, okay.
Everything was the same though. Like, the eyes, nose, and mouth look the same. And your eyebrows are, like, in the same position as well. Oh, I'm glad they let you through. Imagine if they didn't. How would you get home?
Well, ID Hospital gave me like a letter that said that I got the surgery done here. So maybe you can use that. I don't know. I'm not sure. A disclaimer, there is blood in the video and photos of day 1. So if you don't want to see that, skip to this timestamp. Okay. So this is me just waking up after my 6-hour surgery.
Oh, I see blood.
And I don't know if I look like... Do I look like... Because I actually feel so bad. Like, I couldn't move. I couldn't
You look
breathe.
like you got run over by a truck. Like, literally.
I actually felt like it. I woke up and I'm like, is this what it feels like to be run over by a truck and then a bus and then another truck? Because that's what I feel like.
Well, you're talking right now, so you're breathing right now and you're alive right now, aren't you?
Yeah, I know, but it was so hard. Like, can you hear me breathing? Like this, like, I recorded my breathing sound. It was so hard.
Well, then this is nice.
Yeah, of course they were. I actually felt worse than what I looked like. I thought I looked good for what I felt, you know?
Did someone have to feed you food the first couple of days? Or could
No,
you do it
I was
yourself?
on a drip. So, yeah. I didn't do anything. Anna came to my room as soon as ID Hospital contacted her to tell her I was awake, and it took about 20 minutes. So she came really fast. And she brought medication with her, and she explained all the things I needed to do. Can you see how much medication I have? It's like crazy.
How many, how much medication did she have to take? Like, how many pills? Did she have to take injections?
It was... No, like, it was just pills, really, and, like... Because, like, I can't look at my mouth. Like, I can't move it at all. So it was all liquid stuff, all powder. Oh, it was horrible, actually. But yeah, day 1 was super rough. I wasn't allowed to have a drink of water for 18 hours. My throat was the worst part of it. Like, it was so dry.
Oh,
Like,
I hate that. It's like having a really bad cold.
No, you don't understand. This is, like, beyond dry throat. This was painful.
Could you, like, taste the blood in your throat? Is that how dry it was?
No, it was like I was drowning in mucus.
Ew.
I couldn't breathe. I couldn't swallow. Oh my god, you can't swallow anything. Like, your throat is disabled and so dry.
Was it the worst suffering you've been through?
Yes, it was the worst. Like, I don't think I don't know what childbirth is like. If it's like this, then oh my god, I feel sorry for every mother on the planet.
Poor sister.
But
it's alright, you're still alive.
it was the worst pain I ever been through, most discomfort I've ever felt. So Anna came in the morning again, and I was scheduled for my tube removal. So these tubes are inserted in the side of my cheeks. I just remembered this. I don't want to watch this. I'm sorry, sister. You can watch this, but I'll just explain it to you because it won't look as bad because the light's directly on my mouth. You can't see anything, but I can feel it.
I can't see anything.
Yeah, good.
I can see the pain in your eyes.
My soul left my body. Like, I was like, this is not my body. The pain I'm feeling, the discomfort I'm feeling is not real.
Oh my god, you look like a blackfish.
Yeah, I know.
Oh, it's like your cheeks are like triple the size. Like actually triple the
Yeah.
size. Damn.
I couldn't close my mouth, so I was just drooling a lot. These are before and after photos, I guess. Before my tube removal, you can see my face.
Yep.
And this is my first drink ever since I woke up from the surgery.
How many hours was that?
18, I think, or something. I was on a drip, so I wasn't dehydrated. But I wanted the water to, like, because my throat was so dry. But I couldn't even swallow it. I couldn't even swallow it because my throat was so dry. You can't actually move your throat. So the water was just sitting in my mouth, and I was like trying to like hula hoop it into my throat, and then I just ended up choking.
Were you like, oh no, I can't drink water?
Yeah.
How am I supposed to eat food if I can't drink water?
I wasn't even hungry. I was just like in discomfort, you know. I had to stuff tissues into my face because I just kept drooling. It was just still uncomfortable, and I only slept like 4 hours that day.
Oh, you wrote a little message on the board because you can't talk. That's really, I feel sad.
I don't think this video shows how hard it was.
It doesn't.
You don't understand. I couldn't do anything.
You couldn't talk, could you? You couldn't drink water.
No. Oh, you didn't know? I can't talk. I couldn't talk for like so long. For like 2 weeks probably.
Because your jaw was like dislocated, yeah? Was it dislocated?
Well, yeah, it was like a mixture of I couldn't move my muscles, and I had to keep my jaws shut together. You know the wafer? There's like this plastic, or I think it's acrylic actually, mold that I have to bite into, so I basically keep my mouth closed. So this was day 3. I was discharge day, and the doctor came to see me in my room. My jaw wasn't aligned yet, so the doctor had to brute force it into place and put elastics to hold my jaw in. So up till day 3, my jaws were like not together.
Let me just say you're a very, very brave woman for going through this experience. I don't think I could ever get my jaw cracked open.
I don't think I was brave. I think I was just very, very fortunate to have a good doctor and a good clinic to look after me, because, I mean, can you imagine doing this without, like, Dr Korea to find you the good surgeons and clinics and then, like, take care of you from, like, the hospital to the airport?
Nah, like, honestly, I would go with Dr Korea if I were to get plastic surgery, just because, like, I'm a very picky person. So, like, if I plan the stuff on my own, I'll probably, like, keep switching doctors. And, like, Dr Korea is a guide for you to, like, find a doctor that's a perfect match to you. So, I feel like it's a lot more organized and a lot less stressful if you go with Dr Korea.
Especially if you're not an organized person like me.
Yeah.
And, like, they just do everything for you. You just follow your case manager around, and she just does everything.
Nice.
Day 3, still discomfort, still dry throat. I had lots of beds, and I had to stand a lot, and I only slept for 4 hours.
Damn, only 4 hours.
Yeah, well, this was my first night alone, and I was really scared, actually, because I still couldn't breathe properly, and I was drooling so much.
Did they have to give you a breathing mask?
No.
Oh, okay.
No, I could still breathe, but it was just like, it was like if you had a really, really stuffy nose, and then you stuff more tissues in it. That's like the level of breathing I was. So yeah, I also had to ice my face, but since my fridge wasn't very cold, I used cold water bottles instead.
You're like an egg. Like, your face is wrapped around in this white thing that makes you literally look like an egg. Gudatama. Yeah, you're literally him.
That's a compression band, so I was supposed to wear that every hour, on and off, just so that it pushes all the water around, I think, or something. So day 4, I was scheduled for deswelling treatment, and everyone gets a deswelling treatment after surgery. You get 3 scheduled treatments, and this was the first one, and they just do a massage, a sheet mask, and a deswelling laser.
It looks really nice, like,
yeah,
the stuff they're putting on. Relaxing. Oh, wow. So 5 days right after, I mean, like, 5 days, like, that after that skin treatment, I can see your skin glowing and stuff. But You still look like a potato.
It's like, did I do so, or did my skin just get shiny? Now this was morning, and this was after the.
Oh my god! You know what you look like right now? American Dad.
I kind of see it. It's because that huge lower section of my face. Yeah.
It's alright. Like this, honestly, guys, I've already seen like Bo's progress in like recovery, and it's only been like 2 months. Her face looks a lot better. Like the swelling has gone down, and she got like the side profile that she wanted.
Mm-hmm.
It's really nice. So I can't wait for you guys to see the result. Are you coughing or sneezing?
This is when I tried to call you. I tried to call you, but I coughed and sneezed. And it happens a lot. Like, all the time. Because...
I know you're in pain and everything, but the video just makes it funny. Because I know you, it's just funny.
You're a horrible person.
Hey man, you would laugh if I...
You know, if Trinity was with me when I was recovering, she'd just be laughing all the time, being like, "Oh my god, look at your face! Oh my god!" Look at
Well, you would literally do the same thing if I went through surgery and I came out looking rounder than my face actually is. Rounder than the fucking... See, there you go.
That's not possible.
There you go.
I'd be like, "Doctor, something went wrong. You can't make a circle more circle."
That just proves it. That evil laugh just proves it.
So, this is day 6, and they say peak swelling is day 3 and 4, but no. Look at me. This is peak swelling. Like...
Can I just say something real quick?
What?
I like the lighting underneath the bed.
Oh, yeah. The room is so...
It's really nice.
They have that on the top, too. It's very ambient.
Oh, wow.
Very nice. Yeah.
I want that type of lighting in my house one day.
Yeah, that's what I was thinking the whole time I was staying there. I'm like, this is how I would decorate my room. I did walking, had to gargle every 2 hours or every time I ate. So if I ate something or if I drank anything, I would have to gargle every 2 hours. Keep it clean so that, you know, when they remove the stitches, it's not infected or whatever. This is my food here.
What food?
I'm like,
juice?
Pumpkin juice or something. I don't know. It was just liquid, okay? I was on a liquid diet for like 2 weeks because I couldn't...
Were you hungry?
No. My body
Why?
was like not hungry. I didn't feel hunger at all.
Because you're like half dying.
I think it's because all the other pain is just like there, so you don't feel hunger. It's like hunger is not even important.
It's like, yeah, not on the priority list, pretty much.
Yeah, it's not. Yeah. So this is showing my big ass face. Can you see how big it is? Especially on one side. Yeah, and I wanted to show like in proportion how big my head was to my body.
I can't. You're like a chibi. You're literally 4 heads. You're 4 heads. If you measure that, that's literally 4 heads.
Yeah, so this is the compression band. It was so hard to put on, especially because my head is so big. And it's also important to keep your nose clean. Otherwise you can't breathe.
Did you like spend the whole day just taking care of yourself?
I was scheduled, like booked full, just like doing the over and over again. It's like a routine every 2 hours because like I just do it on a cycle. And you have to walk a lot
Yeah,
too.
well at least you were staying in a nice hotel room, so
yeah.
That made it a little better, didn't it? Can see the shower head.
Oh, the shower's very nice.
Looks like
yeah, the shower's
yeah,
real
it looks
good.
like a nice shower. Yeah.
The whole apartment's real nice. So yeah, if you go with ID Hospital, this is one of their hotel things.
Yeah, so if you guys want to book with ID Hospital, book the same hotel as Bo. It looks really nice to stay in. Yeah.
My forehead was like the biggest part of my face, but now it's like the cheeks, and that's how much swelling. I knew I was so swollen because it's like usually my forehead's the smallest now. So this is me eating yogurt. It's the only solid food that I could eat.
You're not even eating it. You're slurping it.
Yeah, I had to slurp. You can't. I couldn't move my mouth. I couldn't move my lips. So I just had to shovel it in and go. Oh, this is the best photo of me ever.
Oh
That's my favorite.
That should be a
photo.
meme.
That's my favorite photo.
Me and my boyfriend.
So this is day 7, and the swelling went down thanks to my water bottle technique. You can see the prints on the side of my face.
Oh yeah, you look less like American Dad. Now you look like you look like a human.
I don't know if I look human. The cleaning lady came. She saw me. She's like, oh no. I'm like, oh, is it that bad?
Wait, what?
Because you know the lady that comes to clean the hotel room. Yeah, she saw me, and I'm like, come on, this hotel is full of plastic surgery like patients. This is not the worst you've seen. Come on.
Maybe she thought like that's how your surgery turned out, but like it's only like being on the 7th day, and she didn't see the before. So like she probably thinks that's like the surgery done, and she's like, oh no.
Yeah. So this is 1 week, day 7. I was scheduled for a checkup with the doctor, and he looked at my mouth and said I was okay to have my elastics removed. So I have to still keep my mouth closed. But I can brush my teeth now and take my wafer out as I needed to. Oh, you want to hear a sad story, sister?
What?
So they had to clean my wafer because I had seaweed stuck in it. You know why I had seaweed stuck in it?
Why?
Because I ate birthday soup. You know why I ate birthday soup?
Because that's the only food you can eat.
Because it was my birthday.
Oh!
Are you crying or laughing?
I'm crying and laughing. I'm crying and laughing at the same time.
I know, me too.
That is the best thing I've heard this year.
Wait, put that next to the best photo you've seen of me this year. At least I had the de-swelling treatment, and it felt like a birthday present, I guess.
Yep. It looks really luxurious and comfortable.
Yeah, this one was a lot better than the first one because it was longer.
Mm-hmm.
And also she was more okay to touch my face because I don't think they really wanted to touch my face the first time because it was
Bloody?
still fresh,
Oh,
I guess.
okay.
Oh, that too, and also, yeah. So this one, same thing, kind of different actually. Massage, mask, and laser.
Mm-hmm.
I de-swelled a lot, and I can drink from a cup and can now. So, because I can close my mouth now.
7 days is so long. It's so long when it's 7 days of suffering.
Yeah.
It's like triple the amount of time.
You're
legit.
right.
Because like when I get a cold, like I feel like I died for like a whole month, but really it's only been 3 days. Wait, no, they're doing laser lights on you, like disco.
Yes.
Disco party. I find this funny for some reason because you're lying down, you have a mask on with like sunglasses on, and then
I'm too cool for this rave.
Too cool for this rave. That looks so yummy until I saw how you ate it.
Yeah, that's my birthday dinner. You like my birthday dinner?
No.
I had to like put it in my mouth and shove it down with a straw and then swallow it because I can't chew.
Oh, that looks nice. What is that?
This is bingsu, 7-Eleven bingsu. I couldn't eat it.
Oh no.
There was ice in it.
Oh, bingsu! Bingsu is ice. Did you not think about that?
Yeah, I know, but like really, not fluffy ice. Yeah, we're up to day 14, 2 weeks. And this is my last check. Oh my god. This is stitch removal. And I cried so much. I hurt so much. I cried so much. I don't think anyone cries as much as I did. Because even the nurses were like, come on. It hurt though. Like apparently the nurse said that my mouth was so swollen still that she couldn't really find the stitches. So, like, every time she went to cut a stitch, it felt like she was cutting my lips.
Oh,
it was so painful.
Oh,
yes.
No. She probably was cutting your lips if it hurt that much. Because, like, she said you were still swollen. Like, cutting stitches is, like, literally just cutting the stitch. It's not cutting your meat or anything.
So, yeah, the doctor came, took a look at me, and showed me my x-rays and what had changed, told me, you know, what parts you removed, and showed me how much swelling I had.
Mm-hmm. The x-rays are quite cool. You can see the before and after. Like, did your skull get shorter?
Yeah, he can see the red lines is like all the swell. He's showing me like where my bone is and where my swelling is.
Mm-hmm.
So I was like, oh wow, my face looks real small.
You'll be 6.5 heads.
I don't think so. It's not shorter. It's just smaller.
Okay.
Now they are removing the screws from my gums with a screwdriver.
Oh, what? A screwdriver.
So I cried so much they forgot that I still had screws in my mouth. Because they were like, don't worry, it's over after this little one snip, okay? And then they're like, yeah, it's done. And then they were like, oh wait, we forgot. You still have screws in there.
There's screws in your face?
Well, there aren't anymore. There were 4 screws.
I can't believe you went through this. I can't believe you came out alive, You're untraumatized.
I'm traumatized.
Are you traumatized?
I'm traumatized, man. I'm like, god damn. But the thing is, I would say that if I had an open mouth, a bite problem, I would get the surgery, because when I was healing, my bite was not correct, and it was the worst thing ever. Like, you couldn't breathe. I kept drooling, can't eat properly. I think going through this surgery is important for people who have a misaligned bite.
True.
Yeah.
Yeah. It's definitely worth it if your face is crooked.
Yeah. But yeah, this is my 3rd deswelling treatment.
She just put paste all over you. What is that?
Yeah, it's a mask. So this is like, I don't know, it was very nice feeling. Premium feeling, man. And they left that on for quite a long time.
I've never seen this done before.
Really? Yeah, so after that, Anna took me to COEX Museum. So DocFinder Korea has a tour and shopping service where you can ask them to take you anywhere within Seoul for shopping or tours. And that day I wanted to go somewhere indoors because it was really hot outside. It's a cool place. It's got like an exhibition center which was hosting Comic-Con at the time.
Oh, cool.
Yeah.
Why didn't you go?
I can't actually walk for a very long time.
Oh, I see.
But I would have gone if I knew about it and I was like in fit condition. Yeah, you can see all the cosplay people.
Was your tour guide nice?
Oh, it was Anna.
Oh, it's Anna. Yeah. Anna's nice.
So the place has a cool library as well. It's very aesthetic. I don't know. I've never seen a library like this. It's like people just walk. It's not a read. You can read there, but like people just go there and take photos. Yeah, really good architecture.
I see what you mean. The library is beautiful.
And the place also has a food and shopping area. So we stopped for ice cream, and I really like Korean ice cream. Like, it's smooth and not too sweet.
Nice. Like after surgery, you know. I saw you eat that.
It's the only thing I can eat. I can't eat anything.
Honestly, I would just eat ice cream if I went through the same surgery as you.
You say that. What is this? 2 weeks? Try 2 weeks of eating ice cream. Tell me you want ice cream.
I want something that doesn't make me sad, like that ice cream suit that you had. It looks so sad when you put it into your mouth. Oh, that's cool. That hat moves.
I'm going home, so DocFinder Korea schedules your transport for you from the airport, and for that reason, I do highly recommend going with DocFinder Korea because they just organize everything for you. And trust me, when you are in that state of recovery, you don't want to be like organizing trips to the airport and stuff like that. You just want to be looked after.
Yeah, definitely. You just want to come out alive, pretty much.
Yeah.
Yeah.
I'm also very thankful to ID Hospital and Dr. Tae Sung Lee for my successful operation. I understand now, after having the surgery, the importance of having an experienced surgeon to do the operation and all the equipment and staff required to pull it off safely. Recovery was very rough for me because of my body, and I think if I had this surgery at a smaller, less equipped clinic, I would have a lot of complications. So if you guys are interested in medical tourism in Korea, be sure to check out DocFinder Korea. Links are in the screen or the description below. The last video will be posted next month when I head back to Australia, so be sure to ring the bell to keep updated and also follow us on Instagram.
And also we'll be posting on October the 1st. Get your bells notifications we're gonna post, we're gonna be doing giveaways because we have been MIA for the last year, and we're so sorry about that, but we're very thankful for all our foodie fans. We love you. Mwah.
Also, Trinity will be seeing me for the first time.
Yes.
You know,
I cried. I cried when Bo left. I actually cried.
I didn't think you'd cry. I thought you'd go home, sit in bed, eat your Doritos or some shit. You don't eat Doritos.
I don't even eat Doritos.
Eat your Doritos, drink your Mountain Dew.
I don't even do both of them.
Well, this is how I see it, but whatever.
I eat Cheetos. Get it right. I eat Cheetos and I drink Coca-Cola.
Coke. Okay, sorry. Yes. Okay. So yeah, be sure to ring that bell. See you guys in the next video.
See ya. Bye.